Hi, I'm Dr. Brad Nieset with Benefis Hospital Post-COVID Recovery Program. Right now, across the U.S., there's 40 programs. We are the only program here in Montana, and so anyone in the state of Montana qualifies for our program. We incorporate telehealth so that way we can reach anybody in the state and overcome distance and weather barriers. And we start our first appointment right over the phone, so you can talk with the provider, so we can get that intake, find out what's going on, and that way when you come here, we're able to kind of maximize that appointment time, get the initial testing that we need, and 99% of the time I would say that we can get or find a objectable problem that's probably causing the symptoms in patients. At this point, we've seen enough patients, we have enough data, we really know what we're looking for as far as what's driving these long-term symptoms in patients. Following initial telehealth appointment with one of our providers, usually we'll have a patient come in for initial testing. Based on the results of that testing, that'll help determine what further specialist a patient may need to see. Part of this program, we have every specialty available: pulmonologist, cardiologist. Sometimes we have needs for ENT with persistent problems after either being intubated in the hospital from a COVID illness, and problems with hoarseness or swallowing. We also have mental health providers for a lot of patients that are experiencing problems with mental health. Definitely worsening of anxiety is I think 23% by studies is experiencing that long term. We have a COVID support group that meets weekly. That's run by Dr. Percusa here at Benefis. We also have speech-language pathologists to work with patients experiencing problems with brain fog. We have neurologist, Dr. Lahara, who's doing our testing, which is a 1-hour in-person computerized test here at the hospital. For patients experiencing problems with GI issues, we tend to see a lot of worsening of irritable bowel. We've seen some dietary intolerances also following COVID that have hung on for more than 3 to 6 months. We have our gastroenterologists that are part of our program. Yes, we've seen a lot of respiratory symptoms and significant findings post-COVID, yet with treatments up to about 3 months, we've seen in some cases some of the worst fibrosis complete resolution after a completed course. So at this point, we have not actually referred any patients on for a lung transplant. Here at Benefis, we have not seen an uptick in POTS syndrome in patients long-term with post-COVID. Looking across at other programs across the U.S. also, initially I think you go back to December in the time course when it was pretty new, a lot of these programs, the thought was that there may be a bigger link to POTS syndrome and post-COVID. What we found out is we have worked up patients and done a lot of testing. A lot of these symptoms had probably been driven by the respiratory system, and with treatment of that, we see a lot of resolution of those symptoms. Originally, if you go back to maybe December, January timeframe, there was a lot of belief that the vaccination was going to help resolve or minimize post-COVID syndrome and the symptoms people were experiencing. Data, though, that came out recently within the last 4 weeks has shown that no, that the vaccination, if you're having post-COVID syndrome, you're having problems afterwards, it's not going to help you, but it's not going to hurt you. It did not make your symptoms last any longer. So we've seen patients here from 13 years old up to 85 years of age. Luckily, we have not seen any kids affected in the unimmunized age bracket. One thing that has started to emerge from patients and the data that we're seeing is that disproportionately women seem to be affected 2 to 1 over males. We've also seen that replicated in other programs across the U.S. It's not known whether that's significant or if it's more that women are more likely to come in earlier and seek care. But it's something definitely that tends to trend. The second demographic that we kind of noticed is patients' initial illness, whether they had any symptomatic or a mild to moderate initial course, tend to come in and represent about 75% of the patients we've seen. Once again, that's kind of seen in some other programs across the U.S. where intuitively you would think that a patient that had a more severe hospitalized course would be the ones to suffer long term. While the patients that were more severe in nature received treatments earlier on in their course, it may have conferred a more protective long term to their recovery, and therefore patients that never saw a doctor, never had any medications, just had mild illness are actually the ones that are probably suffering the worst from what we're seeing here in our data. Following COVID illness, 90% of people will get better with no further treatment. At 3 months, unfortunately, 10% of patients continue to have symptoms. If you're experiencing problems after 3 months, you would definitely be a great candidate for us to see and help talk about different treatments that might be possible to speed your recovery. Unfortunately, we've seen patients with symptoms that have lingered up to a year following their COVID illness. So the sooner you come in, probably the better, as unfortunately these symptoms are just not going to go away on their own. As far as qualification for our program, you don't have to be hospitalized and suffering long term to be a patient here in our recovery program. In fact, 75% of our patients had a mild to moderate course. You don't have to have a positive antibody test or a positive PCR testing. A lot of patients, once again, early in the disease, they never went in to get tested, or their initial testing might have been falsely negative. So if we don't need that information, once again, you can just reach out to us for an appointment and we can go over that. As far as how to get it here, you can have your provider refer you directly, or once again go to Benefis website to our COVID recovery program, and you can get it online right there and email us and ask us a question or request an appointment to be seen. So this is a good question, and actually we've not seen an uptick in patients that have had the vaccination, have had COVID, and had lingering symptoms past 12 weeks. We have not seen that type of scenario coming into the post-COVID recovery program. So definitely there's a protective nature to getting the vaccination, even if you do get it and still get the illness. If it does fail, it tends to confer protection as far as post-COVID syndrome. The amount of patients that we've seen in our community that had a vaccination yet still had a COVID illness is pretty low, within less than 10 at this point that I know of. And those patients at this point had not really had long-term problems that we've seen in the post-COVID recovery program. So not necessarily the most dangerous, but the top 5 problems that we've seen long-term after following a COVID illness would be neurologically a brain fog, which for most people it tends to be either looks like ADHD that we see commonly in adolescents, or a mild cognitive defect, which we see in like Alzheimer's. It's a problem with their attention, concentration, problems finding words, and short-term memory. A lot of those, with treatment, we've seen good improvement in resolution of these symptoms within 3 months in some patients. working with a speech-language pathologist or medications. Our second is respiratory symptoms. In patients, we've seen a lot of hypoxemia overnight, and we've seen a lot of daytime shortness of breath with exertion. This has probably been our most significant workup finding. Once again, with treatment, we've seen resolution of symptoms within 4 weeks. Some of the worst symptoms we've seen in 3 months, we've seen complete resolution of the changes that were associated with the COVID illness. Our third top complaint tends to be cardiovascular, palpitations, variable heart rate, chest pain. 5% of those tend to be cardiovascular origin, but the majority, once again, tend to be more the respiratory system and respiratory problems driving those symptoms. Once again, so with treatment of the respiratory problems, those tend to resolve quite quickly then. The fourth problem tends to be loss of taste and smell, which for quality of life is probably one of the bigger complaints, very common. We are following an algorithm, evidence-based, that within 3 months, 75% resolution of that and back to normal taste and smell. The fifth major complaint tends to be just generalized fatigue. Fatigue tends to be involving multiple systems, and usually there we look at different labs, sometimes overnight, oxygen saturations. A lot of it tends to be dependent on respiratory system again, but once again, with treatment of the underlying problems, we see short-term treatments with resolution of symptoms long-term. I appreciate everyone taking their time today to learn more about our program here at Benefis. If you'd like more information here from our hospital, just please go to our website here at Benefis and look up our COVID Recovery Program. We have a link where you can directly email and request appointment to be seen. If you're looking for information out there, the best reliable website I can tell you, what I refer patients to, is covercovid.org. And that is a website sponsored by the NIH, and that's probably where you'll find some of the best studies and the newest information coming out as a resource for professionals and for just individuals out in our community.